A study has found a 46% jump in the number of eczema cases among infants in Hong Kong since the COVID-19 pandemic. Experts blame it on what they call excessive cleaning habits that arose during the pandemic. Here to tell us more about the study is Professor Leung Ting-fan from the Chinese University of Hong Kong's Faculty of Medicine. So Professor Leung, thanks for joining us. We've been told throughout the COVID-19 pandemic to practice personal hygiene throughout. But now your study tells us that actually there were some repercussions to following that strict regimen.
Well, first of all, with the COVID, we know there are actually drastic measures, such as they close down everything, like the sort of, social isolation, with the wearing of masks, very meticulous hand hygiene, and many drastic hand hygienic measures. And we, at that time, actually focused on controlling the disease. Like we don't want the COVID virus to spread around. But then, as a result of these kind of lateral experiments, with very drastic change in what we are exposed to the environment, we think maybe there's an opportunity to look at whether these change in environmental exposures will affect like human diseases. And children, of course, is most susceptible because the immune system is still rapidly developing, especially in infants. So at that time, coincidentally, we actually at the CUHK actually formed the largest birth cohorts in the southern part of China, called the Mummy cohort. Actually, it sort of aims to recruit like 1,500 newborn babies and follow them prospectively. At that time, was first started in 2019, around the May, June. So that's around the time that we started to have COVID. So afterwards, there's observations that we seem to see many kids who were born in COVID time to have more allergy. First of all, is skin allergies such as eczema and food allergy as well. So we thought maybe it's linked to what we are focusing on in this birth cohort about gut microbiome. Gut microbiome, we think, is the sort of organisms that are residing in the gut that actually cause some kind of effect of the powerhouse that drive the inflammation. We call it inflammation inside the body. And we thought maybe this drastic change in the lifestyle and the environmental exposures would affect the gut microbiome, which in turn may cause different diseases to change in the prevalence. So this is rationale behind what we want to study.
So what specific cleaning habits do you think are to blame for the rise? I mean, does it suggest that there been an overkill in this practice?
I would say, well, with the cleaning, everyone, I think we have been using like alcohol swabs and actually very kind of strong cleansing agents, detergents, bleaching agents, and kind of many kind of different cleaning methods. So make the home or the indoor environment as clean as possible. But I would say not only clean, but it's close to sterile, because many of these alcohol and other cleansing agents, they are actually very strong in removing most of the bugs in the environment. So living alone, our body is actually exposed to much different set of environmental organisms. And as we see, this is a very important balance in different bugs inside sort of the indoor environment, in our everyday environment. And this balance between different bugs actually keep the body also in balance, in actually shaping a sort of healthy gut microbiome. With this imbalance, we may selectively actually allow some overgrowth of some bad bugs and reduce in sort of, with the alcohol, with other cleansing agent, remove some good bugs. And with this result, we may see different kind of imbalance in the gut microbiome that drive the human diseases.
So can you tell us more about how your study found a link between eczema and gut microbiome health?
Yes, I think, well, eczema is viewed as one traditional allergic disease that has a very early age of onset, usually within like the first 1 or 2 years of life. And with the allergy, have to bring back to the traditional concept that our infections, like the viral infections, they drive the body to form certain kind of type 1 immunity that fight against this virus and get the body actually well and recover. And there's another arm called the type 2 immunity that actually is linked closely to the onset of allergy. So when we have like a balance of some mild infections, we have the overactivity, slight overactivity of the type 1 immunity that actually help to suppress the type 2 immunity. Without all these exposures of all these infections, then the type 2 immunity would be sort of more active, and that drive the body towards allergies such as eczema. So with the gut microbiome, it, as I said, is a rich source of different organisms that actually helps to drive the type 1 immunity inside the body. Apart from the infections, some bacteria, good bugs, they actually help to keep the good type 1 immunity inside the body. So that when we actually remove all these good bugs and remove the source that keep the type 1 immunity, the type 2 immunity would be more important. And that's the rationale behind all this sort of theory. And in old days, like 40 years ago, we have the so-called hygiene hypothesis that actually says that the environmental hygienes and infections, cleanliness actually have a very important role to play in keeping the body against allergy.
So it seems like your study, though, has highlighted the importance of a healthy gut microbiome then.
Yeah.
Because you're finding linkages with if there's an imbalance that it
Yes.
triggers all these types of diseases.
Yes.
Then what do you think would be your advice then now for like expectant parents who are getting ready for their newborn? How do you think they should protect their future child from this?
I think definitely we have to exercise a common sense kind of approach. We can't actually remove all the bugs. It's not possible unless we are actually in an environment in the inpatient ward that is actually used for immunocompromised patients. Then we actually would very much not want the bugs to be around. But in natural environment, in the everyday living, we have to live with the bugs. So I would say it's to have a clean environment. So obviously, if there's any dirt, like now the flu vaccine, flu pandemic or this flu season, we have to actually exercise certain measures that prevent us from getting the influenza virus, such as like wearing masks in crowded environment, keep our hands clean, and cook thoroughly all the foods before eating. These are the sort of clean way of living, but not to excessively actually try to remove all the bugs, like to excessive use of like alcohol to clean everything in the indoor environment, and also to clean the hands. Because with the alcohol, it will actually remove the grease on the surface of the skin. Without the grease, it actually breaks the epidermal barrier, the skin barrier, that allows the more water to evaporate. So with eczema skin, alcohol is not good because it actually keeps the skin very dry all the time with the alcohol. So I would say we have to keep a clean environment. Definitely influenza vaccine is a good way because with influenza we have very different complications that we can prevent with the vaccines. But then obviously with the usual approach, we should not be over-aggressive in cleaning everything in the indoor environment.
Does this also apply to homes, families with babies, infants, or children already with eczema? Or do you suggest other things they can do?
With eczema, well, of course, if they have eczema is already sort of have a disease, then we have some other means to try to keep the eczema under control. And as I said, the skin barrier is a very important part of eczema management because we have to keep the skin moist, to apply more moisturizer, to try to actually keep the water inside the skin. So that will prevent the dryness. Dryness will help to promote itch sensation and scratch. This itch scratch cycle is very potent in damaging the skin. So eczema, of course, we can try different probiotics as informed from our gut microbiome study. Actually, we found some good bugs with the combinations that we actually can. It's interesting because with the 2 bugs that we include in the probiotic formulation, at 3 months after the treatment, we see that actually it cause an increase of like 30 good bugs to increase inside the gut, and the reduction in more than 20 bad bugs. So the right combination of different probiotics can actually potently modulate the immune system in such a way that maybe there's an additional way to treat eczema babies.
Okay, great. Thank you so much for your time, Professor Leung. Very
Welcome.
interesting.
Welcome.
For more on the study and its findings, please visit scmp.com.